When a child has fever, most parents focus on one thing, the number. Is it 100, 102, 104? But here's what many people don't realize. The fever number is not always the most important thing. Sometimes, what matters more is how the child looks and how the child is breathing. So in this video, I'll explain what doctors actually look for when a child has fever. Welcome to Clinic Explained. I'm a practicing pediatrician, and here we make medical topics simple, practical, and easy to understand. First, let's understand one important thing. Fever is not the disease itself. Fever is a sign. It usually means the body is responding to an infection or inflammation. So when a child has fever, doctors do not only ask how high is the temperature. We also ask, how is the child behaving? Is the child drinking? Is the child breathing normally? Because sometimes a child with a high fever may still look fairly okay. And sometimes a child with a low fever may look much more unwell. This is why the number alone never tells the full story. The first thing doctors look at is the overall condition of the child. Is the child alert? Is the child making eye contact? Is the child still responding normally? Or does the child look unusually sleepy, floppy, weak, or difficult to wake? A child who is tired with fever can still be normal, but a child who is very lethargic, not responding well, or unusually inactive needs much more attention. So the first rule is simple. Don't just watch the thermometer, watch the child. One of the most important things doctors look for is breathing. A fever by itself is often less concerning than breathing difficulty. So ask yourself, is the child breathing fast? Is the chest pulling in? Are the ribs becoming visible during breathing? Is there nasal flaring? These can be warning signs that the child is working harder to breathe. And if a child has fever plus breathing difficulty, that is often much more important than the fever number alone. Next, doctors always look at the symptoms that come with the fever. For example, is there cough, vomiting, diarrhea, rash, ear pain, sore throat? A fever with a mild cold is very different from a fever with breathing difficulty, dehydration, repeated vomiting, or a concerning rash. So the fever is only one piece of the puzzle. The associated symptoms help tell the real story. Age also matters a lot. If a baby is under 3 months old and has a fever, that is much more important than the same fever in an older child. In young infants, even a single fever episode can need urgent medical assessment. Also, if fever is lasting for several days or keeps coming back, the child should be reassessed. Now let's talk about red flags. These are the signs where you should seek urgent medical care. Please get urgent help if a child with fever has breathing difficulty, very fast breathing, chest pulling in, extreme sleepiness, confusion, difficulty waking up, poor feeding, signs of dehydration, very little urine output, repeated vomiting or inability to keep fluids down, a seizure or abnormal jerking movement, a concerning rash, especially if it does not fade when pressed, or if the baby is under 3 months old with fever. These are the situations where the fever number become much less important than the child's overall condition. Another important point is this. Fever medicine is not only about lowering the number, it is also about comfort. If a child is more comfortable, drinking better, and becoming more active after medicine, that is useful information. Doctors often care about this too. So sometimes Comfort matters more than chasing a perfectly normal temperature. So, if your child has fever, don't only ask how high is it. Also ask, how does my child look? Is my child drinking well? Is my child breathing normally? Are there other symptoms like vomiting, rash, or cough? And how old is the child? That is much closer to how doctors think about fever. If this helped you, subscribe to Clinic Explained for simple, practical medical education for parents. And in the next video, I'll explain what doctors really mean when they say it's probably viral, because that phrase causes a lot of confusion. See you in the next one.